consultant pediatric neurologist. I am treating children with neurological disorders, namely epilepsy and other neurodevelopmental conditions or progressive. So I am here to discuss about the lifestyle perspective of epilepsy and usually what we come across in children with epilepsy, the lifestyle issues which prevent good seizure control and ultimately result in resistant seizures in the long run. So here is an advice for the parents that while the child is being diagnosed with seizure disorder or epilepsy, we have to maintain strict adherence to the medications as prescribed by your physician or neurologist. This is because in the initial years, if you don't stick to the medications regularly, or if you are poorly compliant or you are missing medications regularly, then the epilepsy syndrome that the child is having will get very resistant, and when the child lands up with breakthrough seizures or seizure relapse, it is very difficult to control those seizures. Next is the dietary advice that is given from your physician. You have to stick to that particular dietary advice. In epilepsy, we don't specifically prescribe any diet apart from the ketogenic diet, which is a high fat, low carbohydrate diet that can be offered as an alternative or a complement to the traditional anti-seizure medications, and that has shown good efficacy in seizure control in a follow-up period of 6 months. Next is adequate sleep. Sleep has got an immense importance in epilepsy. When your seizures get uncontrolled, the sleep is disturbed, and when sleep is disturbed, seizures again reappear or breakthrough seizures happen. So 8 to 10 hours of daily sleep is recommended, and the child should not be awakened from deep sleep. The child should be properly fed and should not be in empty stomach for more than 4 hours. Regular compliance to medications, strict adherence to the medications, and stop your medicines only with the doctor's advice. And some contact sports are avoided in specific situations where children with epilepsy are at risk of falling down or physical injury, or that can also lead to a mortality or a death of the patient. So follow your physician's advice and you can achieve a complete seizure control in your child. And epilepsy is completely curable as far as pediatric epilepsy, the disorders are concerned. Thank you.